All right, in this video I want to talk about an empathetic communication technique called labeling. This is very, 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 very important in communication with physical therapists or any healthcare provider. Labeling means is a summarization of what they have told you. And so that it gives them an opportunity to say that is right or no, that's not right. So what does this look like? Um, Oftentimes patients will come in, we're finding out what brings them into us. And so they'll say something along the lines, well, I have this pain here and I've tried this, I've gone here, I've been told this, and that's where I'm at now. So then it's our job to then label it. So we summarize. So we say, ma'am, it sounds like you've done this, this, and this, and that could be, I'm sure that's quite frustrating. Or, if they're here, you could say, and since you're in my office, it sounds like you haven't had enough relief. Or maybe if they say they've had some and not enough, whatever it may be, you want to then project just a little bit about where it sounds like they're at. And they can say, no, actually, that was wonderful. I just want to do the same thing. It just wore off. Or, yes, that is exactly where I'm at. Sometimes people say, I know I should be doing more of this. One of the things that I'll sometimes say is, well, I'm sure if when you've tried that before, if it helped enough, you would have just kept doing it. They give me, a yes. That's right. Because typically, if there's something that's going to be really, really helpful for people and they can notice a significant difference, they're going to be doing it. We don't need to convince them to do that. It's when they're told they should be doing something, they feel like they should be doing it, but they never actually saw any benefit or not enough. That's when they don't do it. And so they've already been told something before, or maybe they don't believe what they've been told before. And so I'll make a remark like, okay, you've been told this, but we're not there yet. Sounds like you may question whether that's accurate or not. Yes, that is right. That initially gets good rapport. It gives you that therapeutic alliance. You want to get to that early on. Then as you start asking questions, you say, okay, I'm going to ask questions so I can figure out if I can give you any different information or better information. Uh, and then you can go on with the examination, whatever it may be. On the second visit, also labeling is very important. Really, any subsequent visit. So when they come back, you likely gave them a recommendation on the first visit. When they come back, how are things? We want to start getting an idea of where are they at. And when they give it to you, you want to label it. Okay, so you did this or you didn't do this, and this is how you're feeling. This is better, but this is not. So we want to label, and summarize where they're at with a little bit of conjecture when needed. And so that way they can correct you. So I may say something like, so this, the pain in the shoulder is much better, but it doesn't feel like you're moving it anymore. That's a common thing that'll happen with adhesive capsulitis. Sometimes we can change the pain, but its range of motion hasn't improved. Yes, that is right. Or it sounds like your back is moving easier, but it's still just as painful. We didn't make any change with the pain. Yes, that is right. Or, well, no, actually, the pain is noticeably better, with this, this, and this, but not with this. Okay, then maybe you misunderstood them. They just initially highlighted the negatives, but there were some positives that weren't readily apparent. And so you want to give them an opportunity to either confirm that or correct you. Sometimes it seems like, why am I just going to say what they just told me? That way they know that you know where they're at. You both want to know that you're on a shared understanding. And if you don't get that is right, or something close to that, if they just kind of nod and say, yeah, that's they don't want to be confrontational. You want to, that is right. That's a much more firm way of saying that, yes, you got that label correct. And this is so, so, so important in healthcare because people want to be understood. And if they feel understood, then they're willing to often to let them take them on a journey so they can understand more of what you understand.